Your skin is warning you. 10 vitamin deficiency signs you can't ignore. Your skin is talking to you, loudly. Every day, it sends signals about what's happening inside your body. And while some of these messages are subtle, others are clear red flags that something is missing. What may look like a simple rash, unusual dryness, or a strange change in texture could actually be your body's way of shouting for help. Today, we're breaking down 10 surprising skin signs that may point directly to vitamin deficiencies. These aren't just cosmetic issues. They're visual clues that your body is running low on essential nutrients it needs to heal, grow, and function properly. What makes these signs so fascinating is how specific they can be. A certain type of rash points to one vitamin, while an unusual hair formation can signal a deficiency in another. Some of these clues are so distinctive that dermatologists can often identify the underlying nutrient problem just by looking at the skin. A few of these symptoms are even considered pathognomonic, meaning they are uniquely characteristic of one particular deficiency. Think corkscrew hairs, cracking at the corners of the mouth, or pinpoint bleeding under the skin. These features act like your body's way of writing its own diagnosis. The good news? Most of these conditions are completely reversible. Once the deficiency is corrected, the skin often begins to repair itself within days or weeks. Let's dive into these 10 powerful skin signs and uncover what your body might be trying to tell you. Disclaimer: this video is for educational purposes only and should not be taken as medical advice. Always consult a licensed healthcare professional for any questions or concerns about your health, medical conditions, or treatment options. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Parafollicular hemorrhages and corkscrew hairs. Imagine looking at your legs and seeing tiny red dots surrounding each hair follicle. Now picture the hairs themselves twisted into tight corkscrews or bent like swan necks. This bizarre combination is one of the most distinctive signs in all of dermatology. These findings point directly to vitamin C deficiency, also known as scurvy. Yes, the same disease that plagued sailors centuries ago still exists today. The parafollicular hemorrhages are pinpoint bleeds that form perfect circles around each hair follicle, creating a pattern that's impossible to miss once you know what to look for. The corkscrew hairs are equally dramatic. Because vitamin C is essential for collagen synthesis, deficiency causes hair shafts to form abnormally. They twist and coil as they grow, unable to maintain their normal straight structure. Some hairs break off easily, while others form characteristic swan neck shapes. A documented case involved a 56-year-old man with extremely poor nutrition. He developed these exact findings on his thighs: follicular bleeding and corkscrew hairs clustering together. Laboratory tests showed undetectable vitamin C levels. Within weeks of starting supplementation, his skin began healing and new hairs grew in normally. The mechanism is straightforward but devastating. Collagen provides structural support to blood vessels and anchors hair in follicles. Without adequate vitamin C, your body can't hydroxylate proline and lysine during collagen formation. Blood vessels become fragile and rupture spontaneously. Hair follicles lose their architectural integrity. These signs are so specific that their presence alone can confirm the diagnosis. Modern cases appear among people with restrictive diets, chronic alcoholism, or psychiatric conditions affecting eating. Even dialysis patients can develop scurvy if their diet isn't carefully monitored. 2. Phrenoderma, the toad skin. Walk your fingers across someone's upper arms and feel hard, spiny bumps erupting from hair follicles. The texture resembles a toad's back. Rough, bumpy, and distinctly abnormal. This is phrenoderma, and it tells a complex nutritional story. While vitamin A deficiency is the primary culprit, phrenoderma often signals broader malnutrition. The condition involves abnormal keratinization of follicular epithelium. Instead of smooth skin, you get hard, keratotic papules with central plugs, distributed symmetrically across the body. The bumps typically appear on the extensor surfaces, the backs of your arms, fronts of your thighs, and sometimes your buttocks. They can spread to the trunk and face in severe cases. Each papule represents a hair follicle gone wrong, producing excessive keratin that forms a hard, spiny projection. Consider a 65-year-old man who developed a hyperkeratotic, scaly eruption covering his trunk and extremities. Topical steroids did nothing. Laboratory evaluation revealed severe deficiencies in vitamins A, D, and B12. After comprehensive supplementation, his toad-like skin texture transformed back to normal within months. Randomized controlled studies have proven that intramuscular vitamin A or B-complex supplementation leads to significant improvement. The response confirms what dermatologists observe clinically. This isn't about a single nutrient but often represents generalized malnutrition with vitamin A playing a starring role. Under the microscope, affected skin shows follicular plugging and parafollicular lymphocytic infiltrate. The follicles are literally clogged with excess keratin. Vitamin A normally regulates epithelial cell differentiation, keeping this process under control. Without it, follicles go into keratinization overdrive. 3. Photosensitive dermatitis with Casal's necklace. Picture a sharp line of dark, thickened skin forming a perfect collar around someone's neck. This isn't a fashion statement. It's Casal's necklace, one of medicine's most visually striking signs. It appears exclusively on sun-exposed skin and points to niacin deficiency, the cause of pellagra. The distribution is remarkably precise. Dark, scaly plaques develop on the neck, forming that distinctive collar. The same changes appear on forearms, hands, and any other sun-exposed area. Clothing lines create sharp demarcation. Covered skin remains normal while exposed areas transform into thickened, hyperpigmented patches. Niacin serves as a precursor for NAD and NADP, coenzymes absolutely essential for cellular energy metabolism and DNA repair. When ultraviolet light damages skin cells, NAD-dependent enzymes rush in to fix the damage. Without adequate niacin, this repair system fails catastrophically. Pellagra is famous for the 4Ds: dermatitis, diarrhea, dementia, and death. The dermatitis component is photosensitive, meaning it worsens dramatically with sun exposure. In severe cases, the skin doesn't just darken. It can develop blisters, erosions, or bully. Case reports from resource-limited settings describe patients with sharply marginated, scaly, hyperpigmented plaques on sun-exposed areas. Chronic alcoholics are particularly vulnerable. Some medications, like isoniazid used for tuberculosis, can induce pellagra by interfering with niacin metabolism. The response to niacin supplementation can be dramatic. Within days, patients report feeling better. Within weeks, the skin begins to heal and lighten. The sharp borders blur as healthy skin gradually replaces the damaged tissue. 4. Angular cheilitis with magenta tongue. Open your mouth wide and look in the mirror. Are there painful cracks at the corners of your lips? Is your tongue swollen and an unusual magenta color? These oral findings often travel together and signal B vitamin deficiencies. Angular cheilitis presents as fissures and cracks at the mouth corners, often with secondary infection. The cracks can be deep enough to bleed when you open your mouth wide. Candida or Staphylococcus bacteria frequently move in, turning a nutritional problem into an infectious complication. The magenta tongue is equally distinctive. Your tongue swells and takes on a purplish-red hue. The surface may become smooth as papillae, those tiny bumps that give your tongue its texture, disappear entirely. This glossitis can make eating painful and alter your sense of taste. Riboflavin deficiency is the classic cause, but B6, B12, folate, iron, and zinc deficiencies can produce similar findings. Riboflavin is essential for redox reactions and the metabolism of other B vitamins. When it's deficient, rapidly regenerating tissues like oral mucosa break down first. These findings cluster in predictable populations: malnourished individuals, alcoholics, the elderly, and anyone with malabsorption syndromes. The oral mucosa turns over every few days, making it exquisitely sensitive to nutritional deficits. Clinical trials have demonstrated that riboflavin supplementation resolves these symptoms within days. One key insight: these deficiencies rarely occur in isolation. Someone with riboflavin deficiency likely has other B vitamin deficiencies too. A comprehensive approach with B-complex supplementation typically works better than targeting single vitamins. 5. Periorificial and acral dermatitis. Imagine sharply demarcated, erosive plaques forming perfect circles around your mouth, eyes, and anus. Now add similar lesions on your hands and feet. This striking pattern, periorificial and acral dermatitis, screams zinc deficiency. While zinc is a mineral rather than a vitamin, its deficiency produces such dramatic skin findings that it deserves inclusion. Zinc serves as a cofactor for over 200 enzymes involved in DNA synthesis, cell division, and protein synthesis. It's absolutely critical for skin integrity and wound healing. The distribution is the diagnostic key. Lesions cluster around body orifices. Periorificial means around openings. The mouth, anus, eyes, and genitals develop erythematous, scaly, sometimes vesiculobalous plaques. Acral sites, hands and feet, show similar changes. Acrodermatitis enteropathica is the genetic form, caused by mutations in the SLC39A4 gene that affects zinc absorption. Affected infants develop this distinctive rash along with diarrhea and hair loss. Without prompt zinc supplementation, the condition is fatal. Acquired zinc deficiency appears in adults with malabsorption, chronic diarrhea, or inadequate intake. Case reports describe both infants and adults with periorificial erosive dermatitis, alopecia, and diarrhea. The response to zinc supplementation is often dramatic. Improvement begins within days. Histopathology reveals psoriasiform dermatitis with a telltale feature: pallor and necrosis of keratinocytes. In severe cases, secondary bacterial or fungal infections complicate the picture. The sharply demarcated plaques and periorificial distribution make this one of dermatology's most recognizable patterns. 6. Petechiae, purpura, and spontaneous bruising. You bump your leg lightly and wake up the next day with a massive bruise. Or perhaps you notice tiny red dots appearing on your skin without any trauma whatsoever. These bleeding manifestations under the skin signal problems with either blood vessel integrity or clotting, and vitamins play crucial roles in both. Petechiae are pinpoint red or purple spots that don't blanch when you press on them. They represent tiny hemorrhages from capillaries. Purpura are larger versions, while ecchymoses are the familiar bruises that spread across larger areas. Vitamin C deficiency causes these findings through collagen breakdown. Remember that vitamin C is essential for collagen synthesis. Blood vessel walls depend on collagen for structural integrity. When collagen weakens, capillaries rupture spontaneously or with minimal trauma. In scurvy, petechiae often appear in a parafollicular distribution, surrounding hair follicles in that distinctive pattern we discussed earlier. The combination of parafollicular petechiae and corkscrew hairs is virtually pathognomonic for vitamin C deficiency. Vitamin K deficiency produces bleeding through a different mechanism. Vitamin K serves as a cofactor for gamma carboxylation of clotting factors 2, 7, 9, and X. Without it, your blood simply can't clot properly. Petechiae and purpura appear, along with mucosal bleeding and potentially life-threatening hemorrhage. Vitamin K deficiency is particularly common in newborns. That's why babies receive vitamin K shots at birth. Adults develop it with fat malabsorption or certain medications. Laboratory tests show prolonged prothrombin time and, in severe cases, partial thromboplastin time. Case studies document unexplained bruising ultimately traced to these vitamin deficiencies, with rapid resolution after supplementation. 7. Diffuse hair loss and telogen effluvium. You run your fingers through your hair and strands come out in clumps. Your shower drain clogs more frequently. Your ponytail feels noticeably thinner. This diffuse hair shedding, telogen effluvium, can signal multiple nutritional deficiencies. Hair follicles rank among the body's most rapidly dividing cells, making them exquisitely sensitive to nutritional status. The hair growth cycle involves 3 phases: anagen, growth, catagen, transition, and telogen, resting. Normally, about 85 to 90% of hairs are in the growth phase at any time. When nutritional deficiencies strike, hair follicles prematurely shift into telogen. 2 to 3 months later, the lag time for telogen phase, these hairs shed simultaneously. The result is sudden, dramatic hair loss that can be alarming. Iron deficiency is a major culprit. Iron serves as a cofactor for ribonucleotide reductase, essential for DNA synthesis in rapidly dividing hair matrix cells. Studies show women with chronic telogen effluvium have significantly lower serum ferritin and iron levels than controls. Iron supplementation improves hair growth in many cases. Zinc deficiency produces hair loss as part of acrodermatitis enteropathica. Biotin deficiency, seen with inborn errors of metabolism or long-term parenteral nutrition, does the same. Recent research links vitamin D deficiency to increased hair shedding and possible exacerbation of alopecia areata. The key is recognizing that hair loss with preserved follicles, meaning no scarring, is potentially reversible. Once you identify and correct the nutritional deficiency, hair regrows. This distinguishes nutritional hair loss from scarring alopecias where follicles are permanently destroyed. 8. Hyperpigmentation and pigmentary changes. Your hands and feet gradually darken. Pigmented streaks appear in your nails running from base to tip. Your oral mucosa develops dark patches. These pigmentary changes might make you think of Addison's disease, but they can also signal B12 or folate deficiency. The hyperpigmentation from B12 deficiency mimics adrenal insufficiency remarkably well. Dark patches appear on acral sites, hands and feet, along with palmar creases and mucous membranes. The similarity to Addison's can lead to diagnostic confusion until laboratory testing reveals the true cause. Longitudinal melanonychia deserves special mention. These pigmented streaks running the length of your nails are striking. They can affect multiple nails simultaneously. In people with darker skin, these changes are more pronounced and easier to spot. The mechanism involves impaired DNA synthesis and methylation reactions. B12 and folate are essential for these processes in rapidly dividing cells, including melanocytes. Without adequate B12, melanocytes malfunction. Paradoxically, this can cause both hyperpigmentation and vitiligo-like depigmentation. Case reports document dramatic reversals. Patients with severe B12 deficiency and widespread hyperpigmentation receive supplementation. Within weeks to months, the darkened areas lighten and return toward normal. The nail streaks grow out and are replaced by normally pigmented nail. In vitro studies support these clinical observations. Researchers have shown that B12 deficiency increases melanin synthesis and tyrosinase activity in cultured melanocytes. This explains why hyperpigmentation develops. The vitiligo-like depigmentation seen in some cases may represent melanocyte destruction in severe or prolonged deficiency. 9. Poor wound healing and skin fragility. You undergo minor surgery and weeks later the incision still hasn't healed properly. Or perhaps you develop a skin ulcer that refuses to close despite good wound care. Delayed wound healing and skin fragility point toward nutritional deficiencies affecting tissue repair. Vitamin C is absolutely critical for wound healing through its role in collagen cross-linking. Collagen provides tensile strength to healing tissue. Without adequate vitamin C, the collagen that forms is weak and disorganized. Wounds lack structural integrity and pull apart easily. Zinc plays an equally important role. As a cofactor for DNA and protein synthesis, zinc is essential for cell proliferation during wound repair. It also supports immune function, helping fight off infections that can complicate wounds. Studies show zinc supplementation accelerates healing in patients with ulcers, burns, and surgical wounds. Protein energy malnutrition creates its own set of problems. Kwashiorkor and marasmus result in thin, fragile skin that tears easily. Protein is required for synthesizing all structural and functional proteins needed for tissue regeneration. Without adequate protein, wound healing grinds to a halt. Clinical trials and systematic reviews provide strong evidence. Vitamin C supplementation accelerates wound healing in patients with chronic ulcers. Zinc supplementation is particularly effective in patients with acrodermatitis enteropathica or chronic wounds that won't heal. Case studies illustrate the real-world impact. Patients with chronic leg ulcers or delayed surgical wound healing respond rapidly once vitamin C and zinc deficiencies are identified and corrected. In severe cases, skin becomes so fragile that spontaneous ulceration occurs, followed by secondary infection. 10. Keratomalacia, xerosis, and night blindness. Your skin becomes progressively drier and rougher. You struggle to see when you walk into a dark movie theater. Your eyes feel gritty and dry. This combination, dry skin, night blindness, and eye changes, points to severe vitamin A deficiency. Vitamin A is essential for maintaining epithelial tissues throughout the body and for the visual cycle in your retina. Deficiency leads to keratinization of mucous membranes. Your skin becomes xerotic, abnormally dry and rough. Follicular hyperkeratosis often accompanies the dryness. The eye changes are particularly dramatic and dangerous. Xerophthalmia, dry eyes, progresses through stages. First comes night blindness as rhodopsin regeneration fails in retinal rods. Then conjunctival xerosis develops. Bitot spots appear, foamy white plaques on the conjunctiva composed of desquamated epithelium and bacteria. Keratomalacia represents advanced disease. The cornea softens and can ulcerate, leading to permanent blindness if not treated urgently. This progression from night blindness to corneal destruction can occur surprisingly quickly in severely malnourished children. The condition appears most commonly in malnourished children in resource-limited settings, but adults aren't immune. Anyone with fat malabsorption, since vitamin A is fat-soluble, can develop deficiency. Restrictive diets occasionally cause problems in developed countries. Case reports describe children with severe deficiency presenting with night blindness, dry eyes, and progressively worsening corneal changes. High-dose vitamin A supplementation leads to rapid improvement in early stages. Skin returns to normal texture. Night vision restores. But advanced keratomalacia may cause irreversible vision loss, making early recognition critical. Subscribe to the Human Health YouTube channel for more insights. If you found this content helpful, please like, share, and comment below.